clients to do a baby swan, you can use a table or on the floor. If you do have a table, it's actually much easier to teach them how to do the full extensions, and you can do a lot more hands-on cueings. After she lies down on her bellies, first I need to make sure the forehead is just resting on the hand. Upper trap is fully relaxed. There's nothing shrugging. So for the baby swan, for the baby swan is mostly the neck with just a little bit upper T. Okay, so that's T1, maybe T2, 3, 4, roughly there. Okay, so we only do some part of it. This is her scapula, so that's the upper angle, the superior angles. That's the scapular spine. So scapular spine, but she's in this upper rotation, so that's in very accurate. But if it's downward, it's in roughly T2. So T1, T2, and 3, 4, roughly there. Okay, so we're not going too far. So we'll see how far she can go. The hands-on cues, you can use either one hand or two hands. If I'm using two hands, I'm using my fingers to pull into the base of the skull. So I'm pulling it, right? So get the spine into this elongated position. So I'm going to cue her to take inhale. When she exhale, I'm going to pull the neck. I'm going to cue her to looking up. So she's looking upwards, and nice and slowly to lift up your neck, nice and slow, and stop. Good. Now in that position, if you're watching her from the side, now this should be a very smooth curve. Okay. If she is overlooking, that's too much, just a little there. Good. You can tell there's a wrinkle, right? That means she's over folding into that position. Now that's like a lot of pinching. So she's going backwards. Now this is more like a curved position. So that's her extension, the baby swan. Okay. You can tell the upper T is also elevated from the floor, which means her upper T is also engaged as well. When she's doing this movement, we wanted to avoid some compensations. For this little range of motion, usually it doesn't happen too much. But you do have someone like maybe a very severe, like restricted person, they could have a little bit lower back pain or lower back engagement as well. You put your hands here, she's fine, it's okay. All right, head down, nice and slow, relax. If you want to use one hand, you can put your hand on her neck. You can just cue the movement. The other hand, you can go to the top of the head. Okay, so imagine you're doing spinal reaching forward, right? So I'm also like this person to reaching forward as well. So I'm putting my hands here. So I'm using my thumb to just give her a little bit poking, but not poking too hard, just give her a cue. So I want you to reach to my finger, and now you're looking up one by one. Good. Basically, I'm giving her like the two ways cueing, right? And when she finish, we're gonna start it from the bottom. So lower this part, and this part, and this part, and we finish. Okay. Same thing, you can still using the pearl necklace cue. So you have 7 pearls, 7 vertebrae, and maybe just a little 2 or 3 there. And so starting with this part, you're looking forward. That's 1, 2, 3, 4, 5, 6, 7. Maybe 1 or 2, your T-spine. Finish, nice and slow, all the way down. Okay. Your clients will feel very good when you do this one. Because when you cue her to do this, she's gonna feel it. The feeling will never felt before. Because nobody looking up by cueing one by one movements. Right? So the moment you start to cue her how to do this movement, she's gonna feel, okay, so that's my neck supposed to move. And she's probably gonna tell you, like, let's go up. She's probably gonna tell you, I do feel here, but when you do this part, I don't feel the movement, right? Or maybe she'll tell you, when your fingers go here, the body just go up, right? So you know the difference, you know the mystics. Okay, that's the baby swan. Good? Questions? Yeah, so far so good? Okay. All right, so for the full swan, you have a couple different hands position. Yeah. So right here, you can tell the thumb is roughly around the ear area. You can also bring the hands a little bit forward. You can also bring the hands a little bit backwards. It really depends on how much T-spine extensions you have. If this person is super flexible, they do have a lot of range of motions, you go backwards. If this person is fully restricted, we go forward, which means forward is easier, backwards is harder, progression, regression. Okay, so let's start with a little bit forward. In that position, you can tell the shoulder is aligned with the arms. The shoulder is aligned with arms, so there's no pressure on the upper trap. So she's gonna starting with baby swan, nice and slow, go to that position. When she finished the baby swan, she's gonna keep that baby swan position. Basically, neck and upper T is done. Now she's gonna push him down on the mat, and then nice and slowly to roll up. Lower T, stay there. Good. You notice her elbow is still on the ground. The upper arm is elevated. If she's okay, she can press even further to push the whole body up. But in that position, you need to make sure this part, the lower back, should be relaxed or engaged, but not like too much tense. Right? 它可以是收紧，但是不能够太紧张. Yeah. Or like if she can relax, that'll be way much better. Right? And then nice and slowly go down. from bottom to top. If you notice your clients, when they get down, they're starting to shrugging, it is also a good sign they couldn't go that far, right? So you're supposed to get them even further, or just go back to baby swan. Okay? Because the moment, okay, let's push up. Because the moment she's starting to go down, now this part is supposed to coordinate with the two joints all together. If the body cannot coordinate with the elbow or the shoulders, all the movement will become a spine push into your upper trap. Okay, the spine will push into the upper trap. The upper trap doesn't have enough range of motions, so the person will become pushing up, no problem, get down, become like that, become a turtleneck. So that also means they couldn't have that range of motions. Okay, back to the starting position. Now, if she's pretty okay, you're gonna go backwards in that position. That's where your textbook is. If you look at your textbook, your model on the textbook is super flexible. So she is doing that besides the chest. Okay, inhale to prepare. Exhale, gonna lift, nice and control, cervical spine, T-spine, here. Okay, stay there. She's gonna do, because she's gonna push up. Now she's going to do a posterior tilt. She's going to do a posterior tilt. She's going to fully engage the core and keep pushing all the way. Okay. Now you notice sometimes people will tend into looking over, right? So if she does look too much backwards, you just cue the neck back to the starting position. The arm has to push down a lot, and she has to pull back to engage this part and this part. When she lie down, she's going to nice and slow engaging the core, engaging the pelvis, nice and control, relax the chest. There you go. Very nice. Okay, not too much, just a little, right? So she's fine. Let's try one more time. Inhale to prepare. You can put your hands here, just cue her to do a posterior tilt. Exhale, lifting. Yes, good job. Upper T, nice and slow. Tucking the core. When you finish, nice and slow, starting from the lower back, upper. Oh, there's a little bit shrugging there. Okay, so for her, I would say probably slightly forward. Okay, because after 2 rounds, you notice on the left side that she does have a little bit shrugging.